So there's no doubt that when we give immune checkpoint blockade, we're going to see upwards of 10 to 15% of what we call high-grade immune-related adverse events. And the vast majority of those are reversible with steroids and other interventions, but there is approximately 5 to 10% of endocrinopathies, particularly thyroid dysfunction, that can be lifelong and have an impact on patients, of course. So when we think about the utility of immune checkpoint blockade in the adjuvant setting especially, that's the curative setting, we have to be particularly careful about the benefit and risk calculation for patients. And so we have to put that in the context of what do we know about long-term outcomes in these populations. Interestingly, when you actually survey patients and ask them what are their goals in the adjuvant setting, they'll of course say live longer, right? But they'll actually consistently state that prevention of relapse is a higher priority than mitigation of side effects. And that's not at all to say that side effects aren't important, but the point is if you're asking patients, they say prevention of relapse is more important. And so this goes to this conversation about what is the goal for each patient in terms of their wanting to mitigate relapse versus willing to accept the potential for side effects. And I think that's a patient-specific conversation to have with each person who's facing that situation. Now, of course, how do you manage or how do you keep an eye on them? Well, that's where really good communication with the patient and their caregiver team is really, really important. So they can reach out and get a hold of their team as soon as anything starts to go sideways, because there's no doubt that managing these early is much better than letting them become more significant. And of course, that helps patients out over a longer period of time.